Hi, my name's Charla Malaponte, and I'm a junior at Research College of Nursing through Rockhurst University. And this is my professor, Dr. Rebecca Saxton. The students know her as Rebecca. And I've had her in pharmacology this semester, the fall of my junior year.
I think service learning and our social justice project is a natural fit for a School of Nursing because our purpose is to serve others. At Research College of Nursing, as you know, you participate in our social justice annual project at Niles Home for Children, where our nursing students work with students in the Kansas City area who, for whatever reason, are homeless at the time, and do a variety of activities with them in terms of health teaching, tutoring, just letting them interact with positive youth in the Kansas City area.
So do you have to do the service projects too, or do you go with students?
I do. I do the service project with students. I'm also I help coordinate the social justice project with Lori Vitale, Director of Student Affairs at Research College of Nursing, and I do participate and go with students as well. But we emphasize that when our faculty go with students that they're not going in a faculty role, that they're going as a participant in the social justice project. A typical day in my classroom, it probably depends on what we're doing. I teach a lot of courses. I teach pharmacology to junior students, and so students usually at the beginning of class, we will have an overview of the content. We teach drug classifications and mechanisms of action, and then after that we have to do some kind of activity to figure out how to learn that. So let's see, a couple weeks ago we had an activity where students acted out the mechanism of action of an anti-Parkinson drug. And that is so important because anti-Parkinson drug works in different ways, and so I truly believe now that students will never forget how this drug works.
I don't think I will.
You won't, huh? You thought it was fun?
It was really fun.
I think what I've learned from the students here at Rockhurst is so many of our students come with a background in service and a desire to serve others. And that's such a natural fit for nursing. And I think I've also learned that my students come with so many experiences that can help them to care for others in nursing. And I learn so much from my students each day. Technology, they're much better at it than I am. They can help me, but also just different ways of looking at the world. I think technology has really helped to make me available to students outside of the classroom. At Research College of Nursing, we use a hybrid type format. We have web-based courses and on-ground activities. So with using WebCT, students really have access to me 24 hours a day, 7 days a week. So we communicate via email, students even text me, and I'm really fortunate though, I don't find that students abuse that. They contact me when they need me, and I love being available to them when they need me. Absolutely. I am a big believer in mentoring students, young nursing students. Right now, nursing has endless possibilities as far as graduate education and being doctorally prepared. And I want to do all that I can to take young students in their baccalaureate program and mentor them to continue their education. So right now I'm working with a senior student, Rachel Melson. She did an independent study and research because I taught her undergraduate research class. We worked together to collaborate with a local children's hospital in conducting a research study. And now she is going to present that at local and regional venues. So it's really, really exciting. Well, what's important at Research College of Nursing, I think, is that you will always have your professors teaching your classes. We don't have teaching assistants. And so I think that's really important. We have small student-to-teacher ratios, especially in clinical, usually 8 students to 1 faculty member. And the other thing that I think differentiates research than any other school of nursing is so many of our faculty are former students. So I think that says a lot about Research College of Nursing and Rockhurst University, that so many people enjoyed their experience that they wanted to, in a sense, come home. And that's exactly what I did. So I think that says a lot about who we are. I think nursing is at, like I said, a wonderful time in our profession. In the 10 years that I've practiced as a nurse, I've watched our profession grow in its acceptance among other disciplines in healthcare. We are earning a respect that every member of the healthcare team should have. And I think there's truly potential for people to have a career in nursing. Bedside nursing, graduate education, nurse scientist work, and I think if anyone is interested in it, they should really pursue it, because I absolutely love what I do. And I know a lot of people can't say that about their jobs, so if I could share my passion with others, I think it would be wonderful.